Self-diagnosing sciatica or low back pain mechanically. What's happening in the spine mechanics? So first, take a moment to just try to do some toe touches. If you feel pain in your glute or on one side, or you feel like pain going down your leg, like a sciatic type feeling, that probably is some kind of sciatica. Usually it comes from the low back, like the nerve roots. So if that doesn't feel good, lean back, go into extensions. If this still doesn't feel good after few reps, 5, 10, it starts getting worse, we'll stop. A lot of times it gets better because you're extending, and most of the time sciatica is caused by some kind of flexion injury or intolerance, like a disc herniation. If both of those aren't terrible, then start to go on to these lateralizations. I call this the Jenga block because you're translating, you're sliding your rib cage over to one side versus the other. Most times you're going to find that feeling stuck or some localized pain in your spine going to one side correlates with the side of sciatica. If that doesn't feel good either, again, what you typically can do to help relieve some symptoms right away, in about 80% of cases, is getting on your stomach. If that just slightly reduces the discomfort, go up on your chin, like I just did there, for about a minute. That still helps, but it's not better, go up to your elbows for at least a minute. Unless it starts to peripheralize or radiate into your glute or leg, stop, get out of that position. It just means you're irritating, pinching the nerve. If you can get into the elbows up to a minute, 3 minutes, it feels better, but it still hasn't gone away completely, and you'll know if you stand up and it's still there, and you start to move around, you retest it, like toe touches, it's still there. Well then, try to do these extensions. Max extension. Now, for those of you that feel worse when you go into extension or lean back, in general, this is going to help. Not always, but you have to assess for it. You're bringing those knees up to the chest. It should feel like a good stretch in your low back. After you do 10 of those, I would always get up, reassess. So like if it hurts to stand, do 10, 20 reps. If it feels good, like if it's loosening up, then stand up, see if it feels any better. If it does, you can do more reps until you get it maxed out. And cat-cows, up and down like this, is always a good finisher for whether it's flexion or extension, to assess how much mobility do we have unloaded with flexion extension of that low back. You're trying to work more and more motion into that spine.